So some key structural regions of beta-1 adrenoceptor, we have the 7 transmembrane and alpha helices. So they form a pretty tightly packed helical bundle that will span the entirety of the membrane. Um, Ligand binding pocket is formed mainly within transmembrane 3, 5, 6, and 7. That's just a small visual. And transmembrane 6 is pretty important since it swings outward during activation to create space for that G protein coupling to occur. Extracellular loops, which we can see here, are typically the largest. Number 2 is typically the largest and helps shape the ligand binding vestibule and heavily contributes to selectivity for the catecholamines, again, that epinephrine, norepinephrine, and beta blockers. Intracellular loops, obviously found within that inner membrane, they're pretty important when it comes to dealing with that selectivity, specificity of the G protein and regarding its signal strength. Or amino terminus, located extracellular of the membrane, kind of signaling the marking of the start of that synthesis. So assists, like mentioned, assist in receptor stability and the proper folding for the beta-1 adrenoceptor. So kind of that starting mark. So key structural regions continued. We see helix 8, which can be found right here. It's a short amphipathic helix that directly follows the transmembrane 7 within, again, the intracellular side, as we can see inside the membrane, parallel to the membrane, and is just super important for the interactions regarding the G proteins, lipids, and scaffolding proteins as well. Pocket, which we can see here, this little pocket, it's pretty important to the beta-1 adrenoceptor as a whole, since it's within the transmembrane bundle, where this is where the catecholamines, the epinephrine, norepinephrine, and the beta blockers bind. So again, pretty important when we start kind of moving into a more bigger sense when we were talking about the heart and the kidneys being affected. This is kind of where all of this would start. The microswitch motifs, which is essentially the activation switches, found right here, and these essentially change conformation once the receptor activates and functions as molecular switches for the beta-1 adrenoceptor. A pretty important component is the cholesterol and lipid interaction sites. The beta-1 adrenoceptor has membrane-facing grooves where the cholesterol has the ability to bind to the membrane and aids in stabilizing the receptor's active or inactive conformation. Similar regions we had just previously mentioned, but now kind of putting them into play. Where are they located when we do kind of look a little deeper within this structure? Back to talking about those 7 transmembrane alpha helices, as they are embedded within the lipid bilayer, as we saw before, in this structure right here, in this membrane, and they tend to rearrange during the activation. So the orthosteric ligand binding pocket will bind or block or modulate receptor activation, which we can kind of see that there. Again, it's just the little pockets between these helices. So extracellular loops, as mentioned before, again, they aid in shaping that ligand access and help contribute to subtype selectivity and specificity, as we had mentioned before. And in this diagram, we can see that extracellular loop as well. Again, outside of that, outside of the helice right here. We have the intracellular loop, which we can see near here, again, near that right side, that helice. So they interact directly with the G proteins, triggering that cyclic AMP production. So the helix 8, the C-terminal, we can view here. Important for the anchoring of the membrane and efficiency when dealing with signaling. What is the overall biological function of beta-1 adrenoceptor? What's related to it? What's its function? So basically, it's primarily responsible, again, like we mentioned before, regulating heart's response. Helps control the cardiac output, blood pressure, as well as the renal function. So again, going back to catecholamines, norepinephrine, epinephrine, being heavily expressed in the heart and kidneys. And when activated, receptor couples to the G proteins stimulating and raising the cyclic AMP level and triggering protein kinase A signaling. And this cascade drives several key physiological effects. So, one being increasing that heart rate, speeds up the rate of depolarization within the SA node, um, therefore increasing heart rate and enabling that rapid physiological response during stress or exercise. And also increases myocardial contractility. Um, that beta 1 androgen receptor signaling enhances the calcium influx, making each heartbeat stronger, enhancing conduction velocity, so accelerating again signal conduction through that AV node, those specific nodes, which ensuring efficient coordination of both the atrial and ventricular contractions. Improves rate of relaxation. So, kind of going back to that rest and digest now, the norepinephrine, the non adrenaline. So, again, the protein kinase A mediated phosphorylation increases calcium reuptake into the sarcoplasmic reticulum, allowing the heart to start to relax a little bit more and more efficiently between. And lastly, stimulating renin release kidney, which again I think is super interesting. So that will occur in the juxtaglomerular cells. Beta 1 androgen receptor promotes the renin secretion, initiating the renin angiotensin aldosterone system, and which raises the blood pressure in kidneys, stimulating the renin release and linking heart rate control directly with blood pressure via renin angiotensin system. Beta 1 androgen receptor exhibits bias signaling, meaning different ligands can choose a preference in activating G protein signaling versus beta arrestin pathways, leading to different physiological effects just beyond heart rate reduction alone. And selected beta 1 blockers were specifically developed to avoid beta 2 adrenergic receptor inhibition, reducing side effects such as bronchoconstriction, critical for patients with asthma and COPD preferences.